Now, coming back to the second part on the healthcare. Now, today, as I was saying, there is no reason. So this is how I think of it when I'm starting a company. This is how I create this mindset of what is possible. I realize that our focus on our genes and our DNA is actually the wrong focus. And here is why I felt that was a wrong question people were asking. Today, I do my DNA test. As we know, my DNA never changes as I grow. As I develop many of the diseases, my DNA never changes. So suddenly I become obese and now I'm 200-pound heavier. My DNA has not changed. Now I get diabetes. My DNA still hasn't changed. Now I get autoimmune diseases. I get depression. I get cancer. I can go through all the chronic diseases. I get Alzheimer. I get Parkinson's. My DNA still hasn't changed. Now imagine if my DNA is not changing, how can analyzing DNA can ever give you a solution? So in my mind, what was really going to happen was that as people are developing these diseases, it's not the genes that are changing, it's the gene expression that is constantly changing. And that's literally the epigenetics, right? So what if we can measure the gene expression? What if we can understand what genes are being expressed when people go from non-disease state to the disease state? And if we can know what genes are being expressed, we'll be able to figure out what amino acids are being created, what enzymes are being created, what peptides are being created, what molecules are going to be created. And then you can adjust that using the food and nutrition as a medicine. That means just simply using the food and the bioactive compounds in the food or nutrition to be able to modify these molecules, and we can actually bring the body back into the homeostasis. That was a theory 4 years ago. Today, after I started the company, we have now analyzed several 100,000 people. And it turns out we are able to now see the actual signatures of what makes people sick, what causes people to have diabetes, what causes people to have depression. And we are actually now using the food as a medicine for not only to be able to prevent these diseases from happening, but to be able to actually reverse them. And the reason is our customers are constantly telling us that when they adjust their gut microbiome and they reduce the inflammation, all these things they used to call the diseases were nothing but the symptoms of chronic inflammation. So here, here is the simple thing. A chronic inflammation causes chronic diseases. And now we actually launched a new product that also looks at your blood. And by looking at a couple of drops of blood, we are able to analyze all the gene expression. And now we can see all the mitochondrial gene expression, all the human gene expression, and all the microbial gene expression. And there are only 3 types of genes that are ever expressed in the human body. The genes that are expressed by the microbiome in our mouth, in our gut, and all other cavities. Human genes that we get from mom and dad, and the mitochondrial genes, that's an organelle inside our cell that I believe was actually a bacteria that was captured inside the human cell and became part of the human cell. But it has its own DNA. So what if we can look at all these gene expression? Can we actually now apply the AI to be able to understand what causes people to move from a non-disease state to a disease state? And that's literally what we're doing. We can now measure your mitochondrial health. We can measure your immune system health. We can measure your gut health. We can measure your stress response health. We can even measure your biological age, because we can look at a cellular level what is actually going on. And by looking at a cellular level, we can see how fast are you aging compared to your chronological age.